Welcome back to Face the State. I'm Ariana Bennett. Thank you for staying with us. Well, if you drive through downtown Reno, chances are you've seen a big construction project happening on the western side, but it's not a casino or a tourist destination. It's going to be a major nonprofit medical center. Now, Sharon Chamberlain, the CEO of Northern Nevada Hopes, is here to tell us all about it. Sharon, thank you so much for coming on the show.
Thank you.
So first off, for those who haven't heard of it, tell us about Northern Nevada Hopes.
We are a federally qualified health center, and that means that we provide medical care to individuals in the community regardless of their ability to pay.
And you guys have been in the community for a while.
You know, we started in 1997 as a HIV organization, and so for years we were a smaller organization, had about 600 HIV positive patients in our community, and provided them with medical care and pharmacy in addition to social services and other supportive services. We made this expansion in 2012 and have been growing really rapidly since then.
Absolutely, yeah. Tell us about the project, and we actually have video of it, so we can show that while you tell us about the expansion, the new building.
We're really excited. So right there in the heart of downtown Reno, 5th and Ralston, we have a 37,000+ square foot building going up. This is going to provide a place for a healthier Reno. It's really not just a medical center, it's a community wellness center. And so it really works to embrace the whole person and all the different components that go into health. We recognize that health isn't just your diabetes or your hypertension or your HIV status. There's so many other pieces that go into it, socioeconomic pieces, not having a job, being homeless. So many pieces can impact your health and your ability to care for yourself. And that's really what we're building here in downtown Reno, is this place where somebody can come and get the entire being taken care of.
It's so exciting. I mean, compared to the facility that you used to have, how big of a difference is this new building?
Wow. So if you're from and have been around, you remember we're across the street from Betos and JJ's, and it was a low-slung motel, and there was dental offices in it for years. Very small and just not really attractive. But what we're working on now is this building, and it's going to allow us to expand so much the number of people that we serve now. And that's a big push for Reno and being able to have a healthier environment.
Yeah, so tell me about the people who you typically serve. I mean, is it a pretty wide range, or is it mostly low income?
You know, it's interesting because a lot of folks think of us as a very low income facility, that's really who we target. It's absolutely anyone is welcome regardless of their ability to pay. However, we take all the insurances, we take Medicare and Medicaid. And one of the things, you know, in the community is for anyone seeking a very holistic approach to their well-being, it's a great place to get expert, professional care, and we have a lot of services that, you know, some other smaller offices might not be able to offer. We have, you know, prescription delivery services. We have transportation. So many of the seniors in our community struggle with just being able to get their medications or go into their appointments because they don't have access to transportation. So it's really a facility that serves the entire community.
And how many people do you think that'll end up being?
So by 2016, we'll have about 10,000 patients and be doing over 50,000 visits a year.
Wow, how do you pay for all that?
Well, we get some grant funding, and we also, you know, have income from our clinic services as well as from our pharmacy. We also rely a lot on donations in the community, and you know, there's many ways that you can support Hopes. You can certainly provide you know, donations, in-kind donations and monetary donations. We always love those, and you're welcome to do that whenever you want. But also, you know, if you are insured and you're looking for a medical home, it's a great way to support folks that don't normally have access to care by coming and you know, having insurance and coming and getting services at Hopes.
Okay, so if someone who has insurance goes there, that helps your ability to help someone who doesn't have insurance.
Absolutely.
Okay, so it's getting the services you're getting anyway, only a little bit altruism on the side.
That's right.
All right, that's a good little feel-good system you've got going on. All right, so you guys have added a few new programs too. I want to talk about the childhood psychology, or is it psychiatry program?
Psychiatry.
Why did you want to add that to your slate of programs?
You know, mental health services in Nevada are really lacking, and that we haven't had a whole lot of investment in it. And what we do when we look at individuals is we really try to understand what are the gaps in the community and what can we do to help fill those gaps, as well as better serve the populations that we're working with. And one of the pieces that was really missing in our community was child pediatric psychiatry. And so we thought about it, and looked at a lot of numbers and said, yes, there's a big need for that, especially for folks that have children that are struggling because they are lower income and maybe don't have access to go to a psychiatrist. So we started this program, and it's easy to get into. It's a very, again, holistic approach with, medication is not the first thing. But we do medication management for children that are on medication. We have behavioral health services, which is the counseling side also, in addition to looking at the physical components that go with that.
What kind of mental health issues are we talking about that comes up with kids?
So many kids nowadays are having some different struggles, right? And I think there's a lot of experts out there that have different ideas about how to help address those. And so we work with kids that are, yes, that have ADHD or other diagnoses that are really inhibiting them from succeeding in school or in other social environments. And what we like to do, again, is just taking those kids and the family and really looking at the whole unit and saying what's missing. A lot of times a kid might be struggling because they're living on a hotel down on 4th Street with their family, and they're moving every couple of months, and they're changing schools, and those pieces are really parts of your overall health and well-being. So when we can engage an entire family in the community to get those social supports in place, help people by working with other agencies in the community to find jobs, to secure housing, to all of those pieces that help stabilize a family, we see improvements in the kids.
So it's not just healthcare, what you do, not just medical care. You guys do work with the other social supports?
We do. So we have a social services department. So everything from helping an individual get an identification, helping folks link into housing, helping people link into insurance benefits. We've expanded Medicaid here in Nevada, and that was a big shift for so many folks that didn't have insurance. And now, we enroll people, they come in, they might not even know that they qualify, and we can enroll folks right there and provide some of those services.
Very cool. Okay, now you mentioned earlier, why you guys got started was HIV testing and treatment. I know that's still a big part of what you do now. Yeah. Tell us about that program.
Our HIV program, we started it back in '97 because in our community at that time, a lot of the folks that were living with HIV were actually having to travel out of state to Sacramento and other places just to get health care. And what we started to see were that people were too sick to travel, or they didn't have the transportation. That's not healthy for those individuals or the community. So folks came together and said, what can we do to create a clinic here? And that's what we did. And it slowly grew, and we work a lot with folks that are living with HIV. There's still a lot of stigma around that. And again, those social supports and the therapy and those kinds of things can really help people succeed.
And other programs too, like stopping the spread through needle exchange programs, for example. Tell us about the needle exchange.
Yeah, so we have a syringe services program, and we're actually the first legal syringe service program in the state of Nevada. I believe that we're the only one in the state of Nevada still. An incredible program, because really what we're doing, injection drug users are often disenfranchised from the rest of the community. And even though injection drug users come from a whole range. You know, folks, we often have this idea that it's somebody that's homeless and living on the street. There's professionals, there's a whole range of people in our community that inject drugs, and they're not talking to their providers about it. And what this program does is allow a safe place for individuals to come in and exchange their used needles for clean needles, keeps the dirty needles off of the street, right? They can safely dispose of them, and at the same time get injection equipment that's going to keep them safe and hopefully prevent them from getting HIV or hepatitis C. And then it serves kind of as a link from the disenfranchised group into medical care, because we can link them right in to our other services.
Okay, now we're running out of time here, but real quick, I mean, for those people who maybe feel stigmatized or don't want to come in to get services, what's your message, just real quick?
You know, come in. We are low barrier, we are open. It doesn't matter where you are in life. We're here to accept you and help you get healthy.
Okay, and always accepting donations from the community. Sharon, thank you so much for coming on the show. I do appreciate your time. Well, that is it for this episode of Face the State, but for more information on everything or to see past episodes, just head to our website, ktvn.com. Thank you so much for being with us. We will see you next week.